Thank you very much, everybody. I'm kind of thrilled to be here. I am absolutely thrilled that there are so many of you here and participating in this. So I just want to talk from my perspective. I see four really clear priorities for the Integrated Care Board in Cheshire and Merseyside. And I'll just talk you through those very briefly. So the first one is delivering today. You know, we have to be in the business of meeting the healthcare needs of the population right now. But I'm just going to kind of stop and think a bit about that and say that has actually included the absolutely Herculean efforts to deliver a vaccine program, the scale of which is nothing like any vaccine program that has been delivered in the NHS before. We have only managed to do that through drawing in a number of volunteers to work and support with the NHS in a way that has never happened before. We need to think about how we capitalise that and keep using those volunteers moving forward. My second priority is recovery. We have to recover from the pandemic. As we've gone through the pandemic, the queue of people waiting for hospital treatment, accessing services is getting longer and longer. My third priority I talk about is then building systems of integration, getting health and social care, health and children's services working together in a way that has never happened before is the big prize here as we move away from competition into collaboration. Much of the way that we've worked currently has been based around a set of competition principles that were introduced to the NHS back in the late 1990s. The fact that now we are talking about our design principle of our operating model being based on collaboration, this is going to give us even more opportunities to work with voluntary sector, faith sector, and other organisations without being bogged down in really, really difficult procurements in a way that we haven't had that opportunity before. Now, we get those first three rights, and it enables us to do a fourth thing. And that's to work on the wider determinants of health, the intergenerational difference that we can make to our population, the life-changing opportunities, people not being born into poverty, people not having their life chances reduced just because of where they are born or the services that they have access to. Now, these things are not, we're going to deliver today, we're going to do recovery, we're going to do integration, we're going to do the wider determinants of health. They're a continuum, and we're spending a certain amount of our time on any given one of those at any points in time. But of course, the better we do the first three, the more headspace and the more time that we've got to think about and work on the wider determinants of health. And that has to be something that we share an ambition for and see as a big prize. So what I would say to you is the ICB is fully committed to this programme of work, to the development of anchor institutions and all that goes with it. But what it needs to be is it needs to be aligned to the core of what we are trying to achieve. And I would observe to you is there are lots of interesting conversations going on in this space. There are lots of examples of people who will come together and talk a good game in this space. But actually, the thing that's going to make the anchor institution work a success is those practical examples that can be pointed to. It was great that you've just had the introduction of things that have happened in Preston and things that have happened in Stoke-on-Trent and stuff like that. But actually, it's got to be our things. It's got to be our things in Cheshire and Merseyside. And Cheshire and Merseyside is a big place, and it creates a fantastic opportunity for us to be able to share, learn from one another and disseminate. So my take-home message to you is don't just think about this conceptually, but think about things that you can do that are practical, that you can celebrate, that are a down payment on the future. So enjoy your session this afternoon. I'm really looking forward to hearing the feedback and the output from it. And thank you very much to all the people who've organised and put so much effort in to get us to where we are today.